As the number of COVID-19 infections grows in the country, there's still confusion as to how public testing sites will operate. For some people, the process is simply confusing.
I don't know. I know nothing about that.
Doesn't that fill you with some anxiety?
Exactly, it does. Because the other thing, they said the kids must stay home, but we're still working and we don't know where to get tested.
Who knows who's got what outside here? And are the people being tested around in this queue?
Yeah.
So what's the government doing to help us?
I don't know where to get tested, but if they can tell me where, then I can go there and get tested quickly.
According to the health department, testing at all public health facilities is free. But first, you have to call the COVID-19 hotline or send a WhatsApp message. You'll then be directed to the closest hospital where testing can be done. On arrival at the hospital, you'll be required to put on a face mask before entering the facility. Then you'll have to find a place in the hospital designated for testing for the coronavirus. And this is meant to ensure you don't wait in unnecessary lines. Patients must, however, present flu-like symptoms, and their test results could take up to 2 to 3 days. While patients are waiting for the results, they're advised to self-isolate if feasible and take precautions. The final step is self-isolation in mild cases and quarantine in a hospital in more severe cases. Self-isolation means limited contact with others. Stay indoors unless medical assistance is needed. While quarantine takes place in a hospital, patients are isolated, ideally in an airborne infection isolation room if available, or a ventilated single room. There's limited contact with healthcare workers. But with the limited number of testing kits available and the current backlog of results, the higher the number of infections rises, the more pressure public testing sites will be under. Nozintombi Mia, SABC News, Johannesburg.